I found out I was pregnant in February. So
Mm-hmm.
yeah, so we started we just came from the Philippines. Uh, we were there until January. So we were just starting to see friends again because we were away for I think a bit more than a bit, probably close to a month. So we were
Mm-hmm.
just to see friends, and then we were hearing about about COVID around December, pa, right?
Mm-hmm.
And when we went to the Philippines, because we had to buy 3 seats now, so we said mag Air China tayo this time kasi around Christmas, but the airfares are very expensive.
Mm-hmm.
We did Air China. It seems like we've done all the wrong things. Then we went to Disneyland pa in Hong Kong, and we were
Mm-hmm.
sure that we've gotten COVID already along the time. So when we got back here, trying to reconnect with friends, like we've missed my Filipino friends and friends of my boy, and then the talk about COVID, it started to do its rounds na, and then parang it was a thing in UK. Um, uh, I'm not sure if you're the same as me. When I log into my Facebook, my social media accounts, most of my friends are Filipino still. So yung balita ko, yung feeling ko, yung nangyayari dito, ano nangyayari sa Philippines, nangyayari dito. So
Yes.
yung the alarm that the Philippines was getting with regards to COVID, parang I absorbed it. So
Mm-hmm.
yung panic, yung panic doon, I felt the panic. So 10 days before the lockdown in UK, ni-lockdown ko na yung pamilya ko.
Mm-hmm.
So we stopped seeing each other as we stopped seeing other friends 10 days before the lockdown here. So parang may head start ako. And then so it was extra heavy on me. It felt extra heavy on me because
Mm-hmm.
um I was feeling what Filipinos were feeling during that time.
Mm-hmm.
When you think about it, we had it better. We have it so much better than the Filipinos are in Philippines.
Yeah,
So
definitely.
yeah.
In my case, it's very difficult kasi yung case ko, pumunta kami ng office tapos at madaming field work, we do a lot of field work, traveling, tapos nung mag-lockdown na, wala na. So bahay na lang. So it's very difficult on my part. How about you, Arwin? Ano yung experience mo as a nurse? The first time na mangyari itong COVID, first months of being in lockdown and working in NHS.
So bale, working in the healthcare side, in general, we were already like having dreadful thoughts about having
Mm-hmm.
a pandemic happening. It's something that in your lifetime or in your career span, you wouldn't imagine having to experience this kind of thing. So in a healthcare side, around early 2020, diba, the cases were slowly skyrocketing in the Asian
Mm-hmm.
side, and then one case happened in the UK. So all of us were like already dreading what's gonna happen in our country. Pero
Mm-hmm.
around March of 2020, when cases were rising like above acceptable numbers. Since I worked in the operating room environment, I work in recovery and anesthetics. I was one of the nurses initially deployed to the ICU to help the workforce kasi we are the bed capacity and the nurse numbers were not that adequate to look after the number of patients already having COVID. So
Mm-hmm.
basically, ako yung isa sa mga nurses na deployed straight to the ICU setting. Also because I had ICU experience back in the Philippines, and when I started in the UK, I was an ICU nurse for 2 years. Pero I had to shift for another discipline because, of course, the ICU environment is, well, kind of intense, and it's sometimes too much for a person to take. Seeing people very poorly and die before you. So that's why I transferred to to the theater or operating
Mm-hmm.
rooms. But then going back to the ICU again, all of us were scared because there was like a mandate or a memorandum where, since
Mm-hmm.
most elective surgeries and all operations are not mostly are non essential. I mean, not essential in a way that it's life threatening. they had to be canceled, and we had to help ICU. So it was very rough, to be honest. But we had to step up, and we had to be resilient because it was the calling that we chose. So even if
Mhm.
takot kami, we were scared, we don't know what's gonna happen to us. We had to look after the people who were really sick. So yes, and that happened for like 3 months or so. Because March to May was like the peak of the COVID during the first wave. Yeah.
Can you describe to us yung parang scenario sa pag very busy ang hospital with all the COVID patients? Ano yung makikita, ano
Um,
yung
sure.
mararamdaman?
So, of course, before you enter the ICU unit, the setting, of course, you have a donning station where you have
Mhm.
to wear your proper gear. On a normal scenario, we don't normally wear a mask even if the patient is non-infectious. But in this scenario, we had to wear a proper gear where we had to wear long protective gowns. We had to wear a mask, a face shield, and we have to double up our gloves before we enter the unit. So when you enter the unit itself, normally in a bed space, there is only one patient, and an ICU nurse ideally would look after one patient because that's the
Mhm.
ICU ratio. But during this pandemic, that's why we were called to help the ICU, because in this scenario, in a bed space, you'd see two patients already stacked in one bed
Mhm.
space. So basically, the capacity of the ICU, from basically, if you think 15 bed space, there is
Mhm.
30 patients because two patients are put in one bed space. And since there were not enough nurses, because we look after patients who are tubed, who are ventilated,
Mhm.
normally one to one ICU nurse to one ventilated patient. But during this time around, we had to look after 1:3 patients with tubes. So basically, it's beyond the scope or the normal depth of practice
Mhm.
because ideally, ang dami mo nang gagawin with just one patient. How much more
Mhm.
if you had three? So basically, ward nurses had to be deployed to ICU to help, like support nurses. Kahit hindi sila ICU trained, they were able to help because kailangan mo sila to run things for you, help them with carrying, washing patients, and things like that. So, well, in layman's, parang palengke yung setting in all the hospitals,
Mhm.
pushed beyond the normal limits. So, and pagod na pagod lahat ng nurses. So, and apart from pagod, takot ka pa kasi you might
Mhm.
have it. And before you, looking back, reflecting now, yung initial wave, ng initial week, parang naiiyak ka lagi kasi parang you see patients pass away before you, and they can't even have their families beside them.
Mhm.
So, and and I remember one time there was this patient na who was I was looking after, na quite well naman siya, responsive but quite ill,
Mhm.
pero awake siya, but trying to fight. You can see clearly that he was trying to be strong for himself. So, and during this time, the hospital devised like iPads, video calls, so that they can see
Mhm.
their families because they can't be there physically, right? So, parang naiyak ako one time kasi I saw the wife like crying before the patient and like trying to be strong, my love, ganon. And ako parang in my pipi, parang oh my God, this is so horrible, like things like this. It's too much to take. So parang it's very draining, to be honest. But anyway, I salute all the nurses, all the frontliners like
Mhm.
me that time kasi they had to really strengthen themselves physically, mentally, socially. I mean, psychologically, equip themselves.